My name is Amanda Cranston. I'm the occupational therapist at Cornerstone. I'm also over the lymphedema and oncology program here, and I'm based out of the Arden location. So this is the second video of a series of 4 related to breast cancer. If you missed our first one, it was on leading an active lifestyle after your diagnosis of breast cancer. And throughout the rest of the series, we'll be talking about various topics to help you, a loved one, or a friend, someone you may know that has been diagnosed with breast cancer, feel healthy and confident. In this specific video, we're going to talk about lymphedema related to breast cancer. So what is lymphedema? Essentially, just this abnormal swelling that happens after you've had breast cancer surgery, you've had some lymph nodes removed, or you've had radiation to that area that may have caused damage to those nodes. We're also going to talk about the role of early intervention and prehab and what that is. So this is just a little anatomy lesson here. This picture here kind of shows your lymphatic system. The most important ones for us for breast cancer are going to be your axillary lymph nodes and the ones in your breast tissue. If you didn't have a full mastectomy, they'll still be there and still can help with the drainage of your lymphatic fluid. So why is lymphedema common after breast cancer? So after breast cancer treatment or diagnosis, you're going to have some lymph nodes tested. Whether you just have the 3 tested, that's it, they were cancer-free, or if one of those comes back positive, they have to take some more. You've got damage to your lymphatic system. So your lymph vessels have a harder time moving that fluid. It leads to kind of a buildup of fluid, which then can cause that swelling to back up in your arm. So this is a good picture to kind of describe why lymphedema occurs, because when you've had lymph nodes removed. So if you think about driving down a highway and you hit some toll booths, more often than not, if there's a lot of traffic, you typically slow down at the toll booth, then you move forward. Same thing happens in a normal system. Your fluid moves up those vessels, it hits your lymph nodes, slows down a little bit because it's got to filter that fluid before it goes back into your heart. So if you think about driving down that highway, you hit those toll booths, but all of a sudden 3 of those toll booths have closed. So all of that fluid now has to, or all of the traffic, has to move over into the other toll booths, which is the same for your lymphatic system. If you remove 3 lymph nodes, those lymph nodes aren't there. It has to move over to the other lymph nodes that are working. So this is like a picture of what lymphedema looks like. So if you notice that one arm is significantly swollen compared to the other arm, and this happens because that fluid gets backed up, kind of like traffic. Does early intervention make a difference? There was a 5-year study completed, and some of the people got early intervention and some people didn't. 30% of those that did not have the early intervention for breast cancer treatment, which means they did not get treatment early after their surgery or have rehab, they had stage 2 to stage 3 lymphedema, which is really hard to treat. It's considered irreversible. It will never go back down to your original size. We like to see people in the latency stage, which is stage 0. You might not notice any swelling, but your lymphatic system is impaired. Or stage 1, you might start to notice a little bit of swelling. Your arm might feel heavy. But in that study, only 6% of people went on to develop that stage 2 to stage 3 lymphedema who had the early intervention. So how is it diagnosed? Here in the clinic, I use just, standard little tape measure. I take measurements of your arm at certain points, and I put in a little spreadsheet. It spits out a little volume measurement for me. Other ways to tell if you have it, you can push down on your skin, which is that palpation for pitting. If you push down on it and there a little indentation stays there, that's what pitting edema is. There's also a stemmer sign, which is done on your hand if you have it for breast cancer patients. And if you can pull that skin up, then it's a negative stemmer sign. If you can't, that means you have significant swelling in your hand, that skin's tight and you can't pull it. And fibrosis would be that hardening of the tissue from the built-up proteins that are in that area. So why attend a prehab appointment? So it's really important to get those preoperative measurements, to take measurement of both arms so we can compare them, but also of that arm. Let's say you had right-sided breast cancer, to get a measurement of that arm before you have surgery, so then we can compare it to after and better see if you've had any kind of change in the size of your arm at that point. We also like to discuss preventative strategies for common diagnoses. So in future videos, we're going to be talking about myofascial pain, axillary Rudd syndrome, and all that. And we like to discuss that in a preoperative appointment just so you're aware of it ahead of time, so you don't feel like, oh my gosh, what's going on? Is this normal? You'll know. We like to talk about pain management and how we can help you with that, and then also develop a rapport with your therapist. So see who you're going to be working with. Do you like the person you're going to be working with? And you can also discuss about what do you like to do? What are you looking to get back to? What are your goals post your breast cancer treatments? So how can therapy help? There's a couple different options. So we do complete decongestive therapy for lymphedema, which means we do manual lymph drainage. We help open up those lymphatic channels, push it out into whether it be your other arm, if you didn't have breast cancer on both sides, your nodes up here in your neck, or we push it down into the lymph nodes in your legs. Compression bandaging, or the use of compression garments to help keep that fluid contained and not allow your limb to get too large. And of course, exercise. So our goal for you is long-term management. We want you to be able to go out and do everything you did before, do more, keep exercising, be able to play with your kids, whatever you want to do and whatever you did prior to your diagnosis. So I would like to have this for you as a resource for what's available out there, whether it be for you, whether it be a family member, a friend. Please forward this to them. Again, I hope this helps. Please contact me if you have any questions. My email is listed on the screen.